I'm the senior rehab assistant with the community falls team. We cover the south of Manchester. Falls estimated cost the NHS more than £2.3 billion. One third of over 65s fall at least once a year, rising to 50% of those over 80, which result in injury are the leading cause of mortality in older people. And following a fall, 50% of older people experience serious mobility impairments. What we need to do to try and prevent the falls and do what we can to reduce those risks. Reasons why we're likely to fall as we get older is the fear of falling is quite a big thing, so people that aren't confident with their mobility, things like that, are more likely to have a fall. Muscle weakness, poor balance, and any like hearing impairments. Your medication as well, so certain medication can cause an increased chance of a fall or a collapse. And then obviously environmental hazards. When you're out and about on the streets, there's lots of trip hazards. So what can we do to prevent these things? The key one is exercise regularly. So I believe the Chorlton Neighbours put on regular exercise classes for you. It doesn't always necessarily mean going to an exercise, it's just keeping active. So it's trying to be as active as you physically can, standing up, just having to move about. Gardening, things like that, things that you're physically able to do, and just keep moving, keep yourself active and moving. That's the key thing, that's what we advise. Check your eyes and hearing regularly, get your hearing checked, go to the opticians regularly, so any issues with your eyesight or hearing, with your hearing and things like that can affect your balance and coordination, which then leads to falls. So just making sure that you get those checked regularly. Ask about your medication, so it's really good to check with your GP to make your medication reviewed regularly, so you're not taking anything that you don't need to take, and to make sure that your dosage is right. And if you are having any falls or feeling weak, it might be that they can change certain medications to help. But that's definitely something to contact your GP. Speak to anyone at the GP surgery. If they don't know, they can't help you. So trying to get outside and getting out for walks or spend time in your garden, things like that will help. And certain foods such as oily fish, eggs also provide a good source of vitamin D. Diet of calcium will also help keep your bones strong. Check your home for hazards, so think about clutter, things for you to trip over, bugs, things like that. It's just being wary of them. Are you managing to get in and out of bed okay? Out your bath, in and out of the shower? If there's any of those things that you feel like you're struggling with, that's something that you can refer to us. It's really important that you make your home environment as safe as possible. Lots of people love rugs and things like that, but they're one of the main reasons why people fall over. And the last one on this is looking after your feet. So it's really important that we look after our feet. So wear appropriate shoe footwear. So we always advise that if you like wearing sandals, make sure that has a back on them. And not wearing flip-flops. We have in our team is we have physiotherapists, occupational therapists, we have a falls nurse, we have rehab assistants like myself that will come out and do the exercise with you. So in terms of referring to us, you can self-refer, so you don't have to go through your GP or anything, but you can go via your GP. If you do find yourself on the floor, okay, I know it's easy and everyone's always telling us is try not to panic. Okay. So the idea is like what you try to do is to roll onto your side, and then you would push up onto your elbows. And you aim to try and get yourself onto your hands and knees. Now I understand this isn't possible for everybody, so we'll come to those. So what you then do is aim to crawl towards either ideally a chair or a sofa, or even somewhere where you can get a purchase about the same height as your shoulders, and then the aim would be then to stand onto you. So if you do struggle, so some people with conditions, things like that, aren't able to get onto their knees or crawl, or you just might be strong enough to get yourself into that position. So there are pendant alarms from the Manchester Community Alarm Service. There is a small cost for this one, but they will give you a pendant alarm which you what you've got around your neck at the minute. So you wear it around your neck or have a watch strap. What they do is they will attach a key safe to the outside of your property so they can gain access, and when you press it, they will essentially they'll call you and find out whether you have actually had a fall, because they always give you a call, but if they don't hear from you or you say, yeah, I've fallen and I'm on the floor and I can't get up, they'll send a team of people around. They come around with a special bit of equipment which will get you back up. So they have a big inflatable cushion which will help you up and they'll get you comfortable, and then they'll, obviously if you need any assistance from there onwards, they'll get the correct people involved. So that's the Manchester Community Alarm Service. Again, if you feel that's good for you, you can ask us about that and we can refer you on to those people.
I just say that most of the good work done here is done by volunteers and drivers here, and without them we couldn't come. And they cannot do that even with most hospital appointments and any kind of things that you need, and without them we'd be lost.
And if you do find that you're in one of these situations where you do feel that you can't get up and things like that, or you do have a fear of that happening, then the pendant alarms are quite a good thing to have as a backup. Thank you very much for your time, and I'll hand you back over.